Today we had 200 or more leaders from across the mental health and addiction sector, leaders from all levels of services, so from clinical leaders right through to people who are leaders on the shop floor. They're all people who are really filled with anticipation about the government's response to the mental health and addiction inquiry and want to know how they can play a role.
My life changed, and the life of the 6 of us on the panel changed last year when we were given the great honour and the great responsibility of undertaking this inquiry on behalf of the people of Aotearoa.
And so as we travel across the country, there was voices of pain, voices of sorrow, but mainly of voices wanting change. No more of being bounced from an alcohol and drug service or mental health service, and the need to actually work together in collaboration and in partnership so that we can participate along all those services as well as our consumers.
The mental health and addiction inquiry has really raised a whole lot of questions about how we do things. Many of our leaders, many of our organisations struggle with the idea of how to make those transformations. I think today's event is an opportunity to talk about how we can get ready for that transformation and a way to do that. And I think the challenge will be for everybody here to think about how to make it real going forward.
It's timely now for New Zealand to address inequities in a meaningful way. It's timely to just for transformational and sustainable change in the health system, particularly for mental health and addictions. It's time to pivot. And I think the only way we can pivot is actually working together.
There is not one person who's going to be able to lead the change or do the change. So we all have to think about that. So it's a shared responsibility. It's not a health responsibility alone. It's not a secondary services responsibility.
So the theme of this conference is about an agenda for change, and I'm not going to say too much about this, but I think Barbara made this really nice comment, is that we have implementation dysfunction. So we're extremely good at identifying and refining and articulating our vision and our ambition. We're not so good at delivering on that ambition.
We all say we want change, but we all find it individually really hard to do. I'm right in the midst of all of that at the moment, where we've got 100 priorities, things come at you, and how do you step back and be able to see the great methodology that should be used in implementation science for change.
So this afternoon's session was focused on the introduction of a potential change, complex change framework. And Fraser, Todd and Terry Huriwai guided us brilliantly around understanding some of the key concepts of this change framework.
You know, we really need to ask courageous and challenging questions of ourselves and just ask, you know, is my mahi, is the work we're doing contributing for the collective good, for the collective gain, in the right way for all people in New Zealand?
And then coming together talking about change and hearing some of the real key messages around change has been really inspiring, and I think a lot of people are leaving today feeling quite inspired. Let's not wait for others, let's not wait for government, let's not wait for the Ministry of Health. We have the skills, we have the know-how, let's get on and do it now.